Hello, my name is Ruth O'Neill, and my paper that I did was substance abuse in rural Alaska. Um, First, I would like to introduce what I discussed and reviewed in terms of substance abuse in rural Alaska. Uh, Substance abuse is a problem in which we discussed and reviewed in the health problem sections, or just in health in general with Alaska Native groups. Alcohol is the main focus here, since the rates of alcoholism is very high in these areas, and with Alaska Native people. This is not the only health problem that Alaska Native groups do have, but it's one of the main topics because alcoholism affects Alaska Native groups along with American Indian groups in the lower 48. Alaska Native groups are the numbers of abuse in these villages are two times greater than any other community in the United States. Um, Even with the increase of programs, law enforcement, there still continues to be alcohol abuse, and it still continues to be a problem. Um, with the focus of alcohol, it's a chemical substance usually associated with drugs. Um, it's not associated with drugs, but it can have the same problems as drug abuse. It's just addictive dependence for people. But with Alaska Native groups, it's a very high statistic. And in this paper, I discuss the history and the rehabilitation or the preventative out outreaches that Alaskan Native people do have, but sometimes is limited to. And also, I discuss why the problem with alcoholism is still a problem to this day and has been for the past 30 years. In many communities, they have a history with Western influence, and mainly it leads to a lot of problems. It creates the increase with criminal activity. This can be from violent crimes to nonviolent crimes, domestic violence, um, uh, just and can lead to other health problems, suicide. It increases the rates for that, and also it increases a lot of other rates. Um, Although it has been banned from many of the villages in the state of Alaska, it leads to other crimes such as bootlegging, and also people like to make their own substances inside the villages. History is a huge factor and has had a great impact on the Alaska Native life. Western influence um, has led to these problems inside of villages, and most people would like to think that the Russians had a huge impact on the way that Native Alaskan groups use alcohol, but mainly it was the British and American impacts. Mainly because the Russians didn't really, they controlled this on the rates of how Alaska Native groups did use alcohol, or how they obtained it. The Russian culture is very based on the consumption of alcohol. Native groups at this time did not think of the alcohol as an entertainment type thing. It was not used at all, but one factor that played in was the tobacco use. After a while, they became dependent on this tobacco, but also led to, with the British and American influences, it started to transition to how alcohol became a dependent for Alaska Native groups and an entertainment factor when these other people, such as the British and Americans, came to associate with these groups. After a while, when the foundations for Western civilization is that a lot of Alaska Native groups lost a great deal of their language traditions, and a lot of people considered that they weren't used of the diseases, or they weren't immune to the diseases that were brought in by Western people from other places. Most native people that are affected use alcohol as an outlet to forget the trauma and the loss of their culture, or just the trauma of losing their people, for that matter. And it was an outlet for people to release their anger or their traumatic experiences. Transitioning from the Western influence, I would like to discuss the rehabilitation programs that rural Alaska does have, and why it's so limited to Alaska Native group people. Hopefully in the next few years that it'll increase, but there is not enough funding for healthcare needs for both American Indian and Alaska Native people. Substance abuse treatment in the United States is largely funded, but in the last few years, for Native people, that has not been the case. Medicaid and substance abuse and mental health services is highly used. Medicaid being a huge provider for Native groups, funding is important for these people who are substance abusers and that don't have the money to go out and have these resources. Funding is not the only factor that comes into play with these programs. Educational factors about alcohol abuse and the use of alcohol and what it leads to if not used properly, or if and what long-term effects they can have on the body or families. People who do not always come in contact with the rehabilitation programs, the spiritual and culture way of this can help, especially inside of communities, so that these people don't have to go out and spend excessive money on the things that they need. There's a lot of questions why alcohol abuse has not decreased in the last 30 years. Poverty and unemployment is a huge factor, and education is a huge factor in this problem. Even with the stricter laws and an increase of law enforcement, the inequality with Alaskan Native people, and which leads to the continuation of the alcoholism problem. And with this repeated loss, it's a higher and earlier rate and unexpected transition or effect that it has on people that haven't got the chance to go out and live on their own. Increase with the education. The increase of high school dropouts also leads to kids not having, or teens not having, the skills to go out and get employed, or the jobs that are limited inside of rural communities. With these factors, it's sometimes really hard for people to rise above the poverty line and not get the resources that they need. In summary, really, I just discussed the Western influences, the rehabilitation centers, or the programs that are associated with the traditional way of life. And I also discussed why this problem continues with Alaska Native groups, or why it continues with the American Indian communities in the lower 48. Treatment in communities are a huge factor in preventing and to the solutions for these people and for any other troubled area with alcoholism. And hopefully in the next few years this will decrease, even with all the factors that are put into it.